If you've recently completed cervix self-screening and HPV was found in your sample, have a history of precancerous cells on your cervix, use a pessary, or prefer to go to a healthcare provider for cervix screening, you might find yourself needing a Pap test. HPV, short for human papillomavirus, is a common virus that spreads through sexual contact. Some types, known as high-risk HPV, can cause changes in cervical cells over time. A Pap test can check for high-risk HPV and/or any cell changes these HPV types might have caused before they turn into cancer. The test is free and only takes a few minutes of your time. It can be done by a healthcare provider at their office or clinic. During the test, you'll be asked to undress from the waist down and lie on a medical table with your feet up. You will be provided with a gown or sheet to cover up. When you're ready, a healthcare provider will gently insert an instrument called a speculum to hold open the walls of your vagina to see your cervix. They will then collect some cells from your cervix using a small brush or spatula. The test takes between 5 to 10 minutes. It is usually not painful, but can be a bit uncomfortable. Remember, you're in control. Don't hesitate to ask questions or request to stop the test at any time if you feel uncomfortable. After your Pap test, the sample goes to a lab to be examined. Some of the sample collected will either be checked for signs of abnormal cells or HPV, or both. This will depend on factors such as your age and health history. Your results will be shared with you and a healthcare provider. Depending on your result, you may need to repeat cervix screening when recommended to check if the HPV infection has cleared on its own. Or you may be referred for a follow-up test called a colposcopy to look at your cervix more closely. Remember, having abnormal cells or HPV does not mean that you have or will develop cancer. But it's very important to attend any follow-up appointments. The earlier abnormal changes are found, the easier they are to treat, and the less likely they are to develop into cancer. Anyone with a cervix between the ages of 25 and 69 should screen regularly for cervical cancer. To book a Pap test or to learn more about cervix screening, talk to a healthcare provider or visit this website.